You alright? Good day? What's wrong?
You're choking. Can you talk? Come on, mate. You gotta cough it up.
Hello, beautiful people. This is Dr. Brownhilda Santo. Today we'll talk about another very interesting and important topic, choking. You know, how to address someone way it choke. So we'll start. So before we even start to see a video of this, you know, when someone they choke, the universal sign they usually be say go put your hand so, and you know go be able to answer you when you talk for ye, it go only the nod the head. So when you see a situation like that, it means that person they choke and you get for intervene for help them. So 3 techniques then for children and adults, you use the abdominal thrust. Meanwhile, for picking them, infants them, you use back blows and chest thrust. So if the person it choke, you know, encourage it cough actually if he did say the one it choke, but then it gets some small cough or it try for cough, encourage it for cough, because if he just dislodge the object from a throat. But if not, you start abdominal thrust, especially if now for children or adult, also known as Heimlich maneuver. So you go put that person in front of you. You use your fist. You put them just above the umbilicals, support them with the other arm, and then you do abdominal thrust. You push, you know, and try to dislodge that object until the person feet talk or cough, or if they pass out, then you put them now for down, and you go then start that CPR way. We don't do and so for that or other talk we don't talk, and then you know you go call for help, and so you continue with the with CPR until help arrives. Now we go also now switch talk about infant. For infant, you do back blows and chest thrust. You do 5 each. You support the head and the neck with your hand, one hand. Use the other hand in between his shoulder blade. You do 5 of those back blows, and then you turn, you support the neck and the head with the other arm, and then you do those compressions of 5 on, and you continue so until the pikin start cry, or if the pikin pass out, then you go put the pikin now for a hard surface, and then you go do that CPR way we'll be doing so for that other lecture where you go do 2 hands and 2 fingers you do CPR and then call for help. Now we'll go look at special circumstances and where maybe you didn't you one. If you don't get anybody around, if you actually do your own, you know, put your hand for that area, see that area where that woman put on, so you also lean against an object and you push for try for dislodge them as way the woman they do and so. Now another way this two for do them, put chair in front of you and then you do that technique for try for push them. If the person be pregnant, you go put your hand like that for you know higher up for a chest and for do that Heimlich maneuver, and then you go push in as where you see as they demonstrate and for try now for dislodge them. So we don't see techniques on how to address a choking victim, and so wait way we need for also remember that say choking the result too from different things. If you do one chop, you chop too fast. If you know the chew your food well, if you chop too fast, it make you it predispose you for choke. And if somebody's let's say it choke and it cough, encourage it for cough, because that one go help for dislodge that object. Universal sign for choking. Now usually so if you see some person where you do want talk for he only nod the head, if you ask and see you choke, he put the hand and so if he talk, no say that person the choke. And in that case you get for intervene. If now for children from 1 year old to adult, then if you do that Heimlich maneuver where you put your hand so you support them and then you do that abdominal thrust. If now for small picking them, infants them in particular from 0 to 1 year old, you do that back where you slap their back, and then you also do them chest thrust. So you put your hands support their neck and then their belly for down, their face for down, and then you do that slap in between you slap their back, in between their shoulder blade. You do 5 of those, and then you turn them around, and then you also do 5 of those chest thrusts with your 2 fingers them. And then if they become unconscious, be it the infant, be it a child, or be it an adult, then you put them for ground on a hard surface. You do CPR like we'll be doing for that other video, and also call for help. So I hope say this video it go help una share this video, una learn these techniques then, because you never know when you will need it. Again, thank una very much. Knowledge is power. Until next time.